The Unconventional Therapist's Guide to Nothing.
Hey everybody, welcome to the Unconventional Therapist's Guide to Nothing. My name is Dave, and I'm joined here with my co-host. His name is Greg. He wears a hat indoors.
That's right.
Do you wear it at restaurants while you're eating?
I do, and sometimes I do feel a little off. Like Tony Soprano is going to come over and say, "You can't do that here."
He should smack you in the back of the head.
Yeah. No, I think at this point in our culture, it's okay to wear a hat wherever you want.
Oh, you hat wearers decided to make that okay.
There is a bold brotherhood, and we do kind of have an idea of like what's appropriate and what's not.
The golf cap boys.
The golf cap boys, yeah. So I think that I am trying to kind of stray away from it. I don't know if you noticed my exposure therapy. Like sometimes we haven't done it in a while. I know you have problems with that.
You
but if I do
it to your head.
Yeah, like I'll do a reel and like it'll just be not only you, the planet, or 400 likes or whatever it gets.
I still get a pretty high level of distress every time I see it.
Yeah. You know, I must have told you that story about that one time that guy really threw me off, and I tell
people that story. He's like, "What are you gonna give me therapy or fight me?"
Yeah. And I was like,
"That's
oh,
best."
Boy.
Somebody asked me why you always wear a hat, and I told them that story. I thought it was hilarious.
Yeah, I mean, but it kind of put me in a weird spot
because you did actually fight him later,
and I did. Yeah, I was like,
and he's like, "I knew it. I never trust you, bald guys.
Can't judge a book by its cover. Apparently, you can."
All right, wait. So,
go ahead. I'm sorry.
So is the problem here that you wear the hat to avoid the feelings of judgment that you feel are going to be passed on you?
Yeah. So any way you slice it, I see what you're doing there. The psychoanalysis. We're not doing that this week.
No, actually, Greg, I'm doing exactly what this topic is.
Oh, you are?
Because I'm actually suggesting that maybe part of this, Greg, is that you stop avoiding the fear of being judged, and you learn how to have acceptance that, hey, my head is bald.
Yeah.
Any little hairs do not grow out of my scalp and form luscious locks.
If my hair grows out, I look like a dandelion. And maybe there's something beautiful about that. Right?
Yeah. You look like a dandelion?
Yeah, you know, those jobs.
That's not a dandelion.
What is that?
I can't remember the name of those. The seed where like the seeds grow. Yeah, that's not a dandelion.
That was part of the phase of dandelion development.
I mean, I feel like you look more like a peach, right?
Well, we're on YouTube, right?
Don't do it. Oh, he did it. The hat is off.
And now it's back on.
he stroked his smooth scalp. I'm doing that for the listeners.
Becoming an Iraq.
Oh boy, excellent. All right. So Greg, what was I trying to get you to accept there? What was that all about?
That was, I guess you could say, an intervention. You know, an intervention that would be used with acceptance and commitment therapy, right?
Yep.
Yeah, Dave. So today we're going to be talking a little bit about acceptance and commitment therapy. I'm going to get into like talk about this a little bit, maybe a little bit of an introduction. I know you're not used to that. Actually, you should be very used to that. That's what I do.
All you do.
Yeah, it's what I do. Developed in the 80s, which I think is fascinating. There's this guy, Stephen Hayes, and normally we do this kind of great little history and talk about this person's development and everything like that. But this is coming out of the 80s. So if you want to understand Stephen Hayes' like thoughts on this, you don't have
go ask him.
You could just go ask him.
Yeah,
really,
he's literally alive, and we'll talk about it probably.
Isn't there something to that that's kind of interesting? I was like, let me see. Like, I want to listen to a podcast about this too. Like this morning, like while I'm getting ready for this one, because I had kind of done the research out of a book for this, and not to brag, but I'm like, all right. So I go through like these podcasts, and there's one that's like Stephen Hayes, and like Stephen Hayes, he's talking on this podcast about ACT.
He's done a lot of podcasts, actually.
Yes,
I was actually surprised about the amount of interviews. I was like, he could probably come on here.
Well,
and then I realized who we are, and I was like, all right, well,
what? Who would that benefit?
let me take myself a step down for a second, because
No, I mean, look, you never know, right? So throughout the course of modern psychology, And we're going to start that with like guys like Wilhelm Wundt. I mean, when we talk about modern psychology, I just mean like when it takes that transition from philosophy to psychology and actual science, right? We get, we'll start at Freud actually, because he's the real father of modern psychology as far as we're concerned, I think, right? So when we talk about Freud, his ideas about thoughts they're needed. They need to be interpreted. They're important. They say something about us. And then you run into guys as this develops, people like Ellis and Beck and other creators of CBT are like, well, and even David Burns, who we're both a big fan of, they would say, well, these thoughts, they're not as meaningful as Freud would have you believe. Maybe they're not correct all the time. Maybe there's something about them that we need to challenge and work and see if there's, another interpretation of these thoughts. And then as time goes on, right, what happens is there comes a philosophy or an even more modern idea of therapy, which I think everyone would be upset with, all the quote unquote fathers of therapy, is that maybe, just maybe, your thoughts don't mean anything at all. And that's one component of this. And I know that's not like a great encapsulation of what this is, but I find that part of this extremely useful for like panic disorder and OCD especially. But we'll get into all that.
Okay.
I mean, what do you think about that, Dave? Like, because that's kind of a radical sort of claim that, and I'm going to get into that more later when we talk about some of the components of this. But your thoughts are meaningless.
Yeah, I mean, you're the first person I've heard say that specifically. I have heard, and I know a lot of this is about like our relationship to our thoughts and trying to make our thoughts less impactful has a lot to do with that, or just try to reframe or reconnect thoughts to different experiences or different ways to look at it to lower the intensity of certain symptoms that we experience.
Yeah, no, see, and whenever I talk about thoughts this way, it does come off kind of confusing, but I thought about this today, literally. If I had a handful of change, right? Just quarters and nickels and dimes and pennies and whatever else. And, think about those as my thoughts. And I said to you, Dave, get me a soda. And, let's just pretend a soda's a quarter or whatever, right? That's all you could use. You would look at my hand and you wouldn't judge the penny. You wouldn't judge the dime. You wouldn't judge the nickel. You would look at them and you would grab the quarter and you would say, I'm going to take this one because this one is what's useful. This one's what's actionable. And this is the one that makes sense. Like the rest of this stuff, they're my thoughts. Yeah, they're there, but they don't really mean anything unless I need them and I can use them and they're actionable. So they mean things. In fact, thoughts mean nothing and everything at the same time because we can have those thoughts and we can grab onto that nickel and be like, all right, I'm holding on to this nickel and it won't get in the machine. It's not getting me anywhere. And it's like, well, why even bother with it? Just leave it there. Don't get upset that all those other, coins are there. Just take the one that you need, take the one that's useful to you and use it.
You're right. So that's where I think like the idea that thoughts don't matter kind of like doesn't really fit that description right there. I do think thoughts matter because they are literally the channel. They're like the thing that channels our emotions, right? So the thought leads to the emotion. We all understand that. That seems to make a lot of sense.
Or the emotion leads to the thought.
Or the emotion can lead to a thought. Absolutely. You're right. So there's obviously a relationship between the two things. I think that we put too much emphasis on our thoughts at times. And I think what you're saying about the change is exactly right. If the thought isn't useful to us, we have to look for another thought that is more useful, that will help us have a different experience. And that is what is a big part of, I feel like, ACT. It's a big part of CBT. It's a big part of like so many different things, because that is essentially it. It's finding the more useful thought.
Yeah, and also part of the ACT too is if we're going to stick with the change analogy, because I think this is kind of working, right? So you're looking at all that change in your hand, and CBT would want you to say like, oh, well, maybe this, you're like, well, maybe this Canadian quarter will work. Like, is this possible? And it's like, well, yeah, I guess that's possible, but like, would it be more useful to use this quarter? So you're hanging out with these coins, and what ACT is like, who cares that there's all those coins there? Like, don't even worry about those coins. Just leave them there, take what you need, and move on. But we'll get into that.
So just kind of in the realm of what you're describing, I was going to say this later, but I'll say it now. So ACT suggests that it's the private experience. And the reason why they say private is because it's individual to each one of us. None of us are going to have the same exact experience with a symptom, meaning which could be like depression, anxiety, OCD symptoms, whatever the symptom may be, pain, anything. Is that what leads to the struggle with the symptom? So it's that experience we have with the symptom that leads us to the struggle. And when they say experience, it's the way that we think about it. It's the way that it makes us overwhelmed at times. So that's what leads to the struggle with that specific symptom. And the aim of ACT is to transform that relationship, either with difficult thoughts or feelings, learn to perceive them as harmless, even if that's uncomfortable, and also transient psychological events.
Yes. This is heady. And you're already sounding it. I think maybe we're both sounding it. One of the drawbacks of ACT, and we don't have to get into drawbacks right now, but as you hear us describe it, it's like this guy, Stephen Hayes, he is brilliant, but it's very heady. That's the problem with it.
I think that you and I, because I've heard some other people describe it, I'm not going to say better, but differently than I've heard him describe it.
Yeah.
In a way that I was able to digest it easier. And I think you and I can do that with some examples and just using different language. But we'll obviously have to keep each other in check because, as you just said, even as we're listening to each other, we're probably thinking, oh, wow, all right, we might lose some people. And this is a really valuable approach. So I don't want to lose people. I actually think we utilize this probably before we even knew we were utilizing some of this.
Yeah. So it's because it's action, really. It's all about action. It branches off some of the versions of behavioral and cognitive therapies that we use all the time. But the idea is to stop struggling, like you're saying, or even avoiding your emotions or thoughts. Just instead accept them. And I think we will talk about this word more because it's like a huge part of this, but the word acceptance, that's sometimes people are thinking like, all right, so I just have to accept this. It's almost like a resignation, like, oh, like, fine, I give up. But that's not it at all. It's almost like accepting something as a gift or like a power shift. It's, if something terrible happens to you, like even if you think of something really terrible, like a trauma, like a rape, or you witness something horrible, or you're abused or whatever, it's like, how do I accept something like that? Well, I mean, it's not your fault that thing happened to you, but it is your responsibility to sort of take what you can and, create a life, right? That's how you get your power back, by not letting whatever happened to you define you. It's like, it could have happened to you. You can never sort of be away from that. That's always going to be a part of you, but you have to accept it. And it's a really hard sort of concept to wrap your head around. But I guess what I'm saying is, like, say you're like, I can't accept that. It's like, well, what's the alternative to not accept it? Like, is that possible?
Well, and I think that's such a big part of this is I think that what ACT suggests is that by denying, by rejecting, by avoiding, we're making our symptoms worse. So that acceptance is, I'm no longer going to avoid the discomfort, avoid the pain, avoid the negativity. Instead, I'm going to, I guess, embrace would be another word you could use, in a hope that my relationship to that negative feeling is going to change and I will experience it in a better way, in a way that's more fulfilling to my own personal life.
Right.
And so also, Greg, one of the things I have to accept is at some point in the podcast, you shorten and you become just a talking head on the screen. I don't know how this happens every single time.
I don't know how that happens, right? Look, that's something you're just going to accept.
Right? Like, there's no chance that you can grow up a little bit.
That's
on the screen. No.
All right, let me see.
It's like you're a tiny person.
Sorry. Look, what you're talking about there is it's
There you
like
go.
it is hard to have this because we don't want to sound like mean, right? So we're not saying you have to accept these terrible things that happen to you. You have to accept, everything. But I mean, if you're denying it and you're, repressing it and you're, constantly trying to like fix it and deal with it, then you're staying engaged with that thing, right?
Yeah.
So it's like if I want, there's this great part of folklore where like a vampire, if you're trying to hide from a vampire in folklore, you could throw some rice on the ground or you could throw some sand on the ground and they have to turn around and they have to count all that. And so they're stuck there. They're dealing with that. When their goal, their purpose, their values are suggesting that they find you and kill you, right? And I'm not saying that's who we are, but what I'm saying is like if we spend all our lives entangled with these things that we want to fix about ourselves, that we want to sort of, I don't want this to be here. I hate this part of me. I wish that this didn't happen to me. And you stay like you're trying to always fix that and you're trying to always manage that. Well, what you're doing is you're keeping it fresh and present in your life when it's like a part of what acceptance is this happened to me. I want to identify my values. I want to figure out how I can still live a meaningful life. And I want to take actionable steps towards that and step away from this. And then as I do that and as my life progresses and I'm living in accordance with my values, then maybe this has less power over me. And that person or that thing that happened to me doesn't have power over me anymore because I'm living my life in a way that I'm taking power again, right?
I'm still trying to get over the fact that you said the vampire's trying to kill you. Aren't they actually doing the opposite and trying to give you eternal vampire life?
Always the optimist.
Right.
You're always the horror advocate, aren't you, Dave?
Aren't they going to turn you into a vampire and then you live forever?
They're going to feed on your blood and steal your mortal soul.
I never understood that. It's like they choose to kill some people, but then other people they give eternal life to. How do you just
could I
assume
hang
they're
out
going
with
to
this
kill you?
person for eternity? Maybe. All right, let's give him the works and let him live. Could I, if it's an absolute no, then they got to kill him. That's how it works.
Just got to accept that.
Got to accept it. So there's a lot of acceptance going on. So here's a great quote from Hayes, and you can see how heady this guy is. We as a culture seem to be dedicated to the idea that negative human emotions need to be fixed, managed, or changed, not experienced as part of a whole life. So we get stuck approaching our problems like this. And if we would eliminate our sadness or angst, so like that's the thing that people kind of forget. It's like, well, if I could get rid of this trauma and if I could get rid of this sadness and if I could get rid of this, anxiety, I will be happy. But that doesn't necessarily, like the absence of that thing doesn't mean that you're going to be happy, right? You have to actively create your happiness through doing things that are, based on your values that are meaningful to you. So that's an interesting part of this.
Two things. First, as far as that goes, like there's been so many times I've worked with individuals on their depression, and then once their depression's kind of like lifted, they report either like, well, first, so many people end up also identifying that they have extreme anxiety, and anxiety is almost worse than depression. They almost wish the depression would come back because that was maybe numbing the anxiety.
Yeah.
But then also I've heard people say like, but I don't necessarily feel happy. I'm kind of like, like in the middle somewhere. And I'm like, yeah, because happiness is about fulfillment. It's not about not being depressed. Yeah, sure. Depression is quite the opposite of happiness, I guess, in some ways. But because you can't even like get into the things that maybe would provide you with fulfillment. But once your depression lifts, you still got to go out and find joy, find happiness. You can't just expect it to come. And then, then I forgot the second thing I was going to say, but I guess that was the main piece.
No, I know. And it's such an interesting thing because it's not about feeling good. We keep coming across this thing where it's like people are like, I just want to feel good.
Yeah. Feeling good is work.
To feel good. Well, so feeling good without work is shameful, right? So I had this patient recently who's maybe doing a little bit too much of he's looking at porn.
But that's not feeling good. That's instant gratification.
So that is pleasure, right?
That's pleasure. Yeah. That's not joy. He's not sitting there going, I'm going to remember this memory forever.
Right. So it's like
that memory did not last him long.
But that's what people are saying when they just want this to end or that to end. Like, I just want to feel good. Well, you can't, if you just feel good without like the work, it's shameful. Like that same person doesn't feel shameful when he, instead holds off and has sex with his girlfriend, right? He feels completely happy when he does that. And that's because he's getting the same sort of pleasure, but it's in accordance with his values. And he's kind of like having to do something that like aligns with his values to get that same sense of pleasure, and skipping the values and acting outside of your values to get that pleasure. Not that anybody should have to feel bad about, masturbation, but
I think we're kind of getting off on like something that might not totally fit this, because we're kind of going into like instant gratification, which then leads into that whole like that's like dopamine hits versus
no, you're right. Like
actual feelings of joy. You know what I mean?
So it's not about. So we'll just say it's not about, just to kind of like get us back on track. It's not about wrestling your emotions and your past traumas. It's more about optimism. Value is going to play a huge role in this. Goals and action, and all you really need. You
said the thing about the before we get way too far from it. You said the thing about society kind of thinking we need to fix negative things, but I also think there's a part of us that are wired that way. And I'll often talk about how I probably have said it on here before. I feel like the brain is wired to look for all the negative experiences. And I don't know that that's necessarily a societal thing. I think that's kind of just how humans operate. Like, because I'm sure that would be probably, in any culture, any country, I'm sure that we would probably find something similar. We are hardwired to hyper focus on the negatives, which, if we're hardwired that way, it makes sense that we're also hardwired to want to fix that negative. Which, like, when a parent's constantly correcting their kid versus looking for only the positive things to reinforce, like, it's work. You have to retrain your brain to do something that maybe is not natural or or instinctual to do. I don't know if that would be the best way to say it.
Well, but, it's like you can't
all work.
It is, but like I think that what the ACT is trying to say is this can't be an internal thing. Like you can't fix your thoughts by thinking about your thoughts.
Yeah. Oh, I'm in agreement with this. Yeah. I just feel like I don't want people to think that what he's suggesting is they're doing something inherently wrong, because then that also goes into a negative thing they think they need to fix.
Right.
Which is like totally against this. But I do think what it is suggesting is that the way that our outlook, kind of gravitates to, we do need to put work into trying to look for a different way to approach it, so that we avoid always like focusing on the negative and then focusing on the need to fix the negative.
Hey guys, I'm Nick Darland, and I invite you to check out my podcast, Power and Chaos. Here's the truth. We're not the worst things that's ever happened to us, and we're not the worst thing that we've ever done either. Our power lies in how we rise from the chaos. Each week, we dive into real stories of resilience, growth, and leadership. Because chaos doesn't define us, it strengthens us. We're streaming on all major platforms. Subscribe today and discover how to turn adversity into strength.
Right, and it's really like distilled down too. It's not just accepting everything. It's accepting the things that you cannot change, almost like that.
Yeah.
Alcoholics Anonymous thing, where like there's going to be some things that if you can change it, but it's not spending as much time wrapped up in your thoughts and being as actionable as you can, and finding values are going to be a huge part of it. But the biggest sort of component of this is psychological flexibility. And this has 6 core concepts. And all psychological flexibility is just this openness and ability to adapt to your thoughts and behaviors to better align with your goals and your values. So to get started on this, all you need is like mindfulness, and values, right? So identifying your values is going to be a huge part of this. There's a million different ways to do that. Sometimes I have people, maybe recently I've been having people, because I got that idea from my own therapist, is, if you have 24 hours left to live, what are you going to do? That kind of helps identify your values. I think of, who do you admire in your life? Who are your heroes? What are those characteristics about those people that you appreciate. There you go. There's some of your values. Like it's kind of easy to get down to people's values, easier than you might think. But the first realm of psychological flexibility, and there's 6, is something we've been talking about all along here, Dave, and that's acceptance. Now, what do you think? I mean, have we said enough about this, or is there anything you want to add to that?
Yeah. So I mean, the intensity, acceptance along the lines of, you know, accepting the thoughts instead of trying to avoid them, because the intensity of the avoidance is what actually increases the discomfort, the pain, the negative emotion. So embracing the fear and pain and moving forward builds empowerment, which thus will improve hopefully your outlook on life, your outlook on that symptom or whatever it is that you're suffering with. And hopefully it will change that relationship. And it's not that it's necessarily going to go away, but you will experience it in a different way that won't be as intense. And it's really important for people to understand, every time you avoid fear, it reinforces that fear. So, for example, if I'm afraid of roller coasters and everybody's hopping on a roller coaster, every time I avoid going on that roller coaster seems scarier and scarier to me, to the point that it's in my head that this thing is going to probably kill me if I ever go on it now. Whereas if I face that fear and go on it, even though I don't want to, I might not enjoy roller coasters, but at least now I know I will survive going on this roller coaster. And my relationship with that roller coaster is no longer now that the point where I feel like this is the thing that's going to end my existence. Right.
And you can have a fear of something and still do it. That's another thing you kind of learn through that process.
Exactly. So my relationship going forward with it, and like, obviously that example is pretty benign. It's not going to hinder my life in any way if I never go on a roller coaster. It's just a thing that I could accept, or I could, choose to dabble in here and there. But what we have to ask ourselves is, what has avoidance cost me?
Mm-hmm.
So, talking from personal experience, I was kind of thinking about like, oh, what things do I avoid in life? And like, what does that cost me? And I'm pretty open about this. I'm like super conflict avoidant. I say it to anybody who asks, like when they, whoever talking about this, I totally relate to people who are conflict avoidant. What does it cost me? Well, probably accepting things that I shouldn't have to accept, probably missed opportunities.
Mm-hmm.
So many things. But you know what it's cost me even more? Unneeded anxiety, because I get anxiety over those situations. Whereas if I just face them, embrace them, worked on going forward, knowing that I'm conflict avoidant, but it's something that like I should try to embrace and do, I would probably feel a lot different, and I wouldn't get the high levels of anxiety I get about it today. So
that's a perfect example, actually. I really like that. And part of the acceptance for you is like, hey, look, this is part of who I am. Do I want to accept that? Yeah. But do I want to get it now that my values are shifting, I'm discovering new values, and maybe I want more for my future. I have to accept that that's part of me, and it's going to be hard to do the things I want to do. But because my values are becoming stronger, like, all right, so I don't want any more missed opportunities. So I might have to live with a little bit of discomfort while I'm pursuing these values. But in the end, I'm going to get what I want, right? I accept that it's there. I'm not saying like, I'm not going to stay with it and be like, I'm never going to be able to do these things because, it's stepping away from it.
There's so many dimensions to it, because one thing I was thinking about, well, I'm not gonna jump into every single conflict, right? So I am gonna have to pick and choose what ones are worth my time, what ones feel necessary. And I'm also gonna have to accept that, like, I'm still gonna have anxiety even when I do those things. I'm gonna plan for that anxiety so it doesn't come as a shock. Goes, hey, I faced my conflict avoidant fear, but I still feel anxiety. Of course, I'm going to still feel anxiety.
Okay.
It's something that produces me anxiety. Yes, totally okay. It's probably less anxiety than if I don't do it and I just think about it for hours. But then I'm going to also have to accept that there's going to be times where, hey, I just don't feel up to embracing this conflict today, and I'm probably going to avoid it. And I'm going to have to be okay with that.
Yeah.
Right.
No,
so there's so many different things that go even into the one theme.
Just changing the way you sort of just accepting that it's going to be there, and like not and not wishing it wasn't there. Like, all right, I'm gonna approach my values. I'm gonna live my life with carrying this with me. It's with me, but I don't have to try to get rid of it anymore. It's just kind of it's just a part of me. And like, can I do things with it there? Yeah. So I mean, it's loosening its grip already, and the anxiety is already lowered.
And
I mean, it's and we're still just talking about acceptance.
And the biggest thing with it too, though, is also accepting that because it's something that I experience doesn't mean I am a negative, some other negative distorted thought. Like, you can imagine all the names that I call myself when I feel anxiety because I don't want to do this thing that could potentially lead to a conflict. You can only imagine the negative thoughts going through my head about myself.
I bet you're saying some pretty nasty things, Dave, and we don't like that.
So that's another thing to accept.
Okay. So number 2, cognitive diffusion. Now, this is one that we've kind of already talked about a little bit, but if you remember what diffusion is scientifically, it's moving particles from an area of higher concentration to an area of lower concentration. So what that's saying from a psychological point of view, again, with these words in Hayes, like, thanks a lot. But what he always really saying is when you have a thought, like the typical, like an OCD thought or an anxiety thought, it's about, that mindfulness approach of having those thoughts, looking at those coins without judgment, and just approaching the thought that is useful or seems like it makes sense to you or is true, or reflects your values. And the ones that don't, they're just thoughts. They're just kind of.
So this takes a level of awareness, though, sometimes, right? Because some people, and I heard an example earlier today, and I thought it was a good example because I hadn't really thought about this. So if you ever have an experience with someone who maybe talks loud, is like a loud talker, maybe their family, maybe it's like a cultural thing, maybe they have like a very active household and everybody's talks loud because you have to in that household because everybody's talking. And maybe you're from a quiet background or a background where like loud meant angry, and there was maybe a lot of like arguing in your background, and that kind of makes, anytime you hear loud voices, maybe you associate that in your brain to conflict, to potential violence, who knows what it could be. You now have to understand that when that person is talking, that doesn't mean violence is happening, aggression is going to happen, anything bad is going to happen. So you have to do what you said. You have to now find a more useful thought that would connect to this situation because you're not in that same situation. So that's kind of like that. That's kind of the basis of this, right?
Absolutely. Yeah. Like, I like that kind of thing that you're talking about there. Like, I'm almost thinking about, when you're driving in a car and a lot of people, there's a lot of chatter and there's a lot of like, maybe there's a baby crying in the back, whatever it is. Like, you're driving your car and you got all these people in your car. You're still able to go where you need to go. You're still able to drive that car, and all those things going on in the back, they can kind of become, you could either, oh, what's this guy in the passenger seat saying? Why is he being so loud? Well, why is that driving me nuts? Why is that baby crying? You could do all that. You can investigate all that. You can get tangled up with all that. Or if your job is to drive the car safely and get somewhere where you want to be, then you can do that too. You can focus. Right. You can have all those things. You can accept that all that is going on in the car and drive and be where you want to be. And that's where we come, that's sort of the mindfulness aspect of this. And we don't have to talk about mindfulness. We've talked about it a million times. But mindfulness, obviously, we're kind of explaining it in a lot of ways anyway, is a huge part of this. When you say awareness, you're absolutely right, because that's essentially what mindfulness is. The next part is the self as a context. Now, here's a heady thing, but what we've talked about Freud, this is id, ego, superego. All we're really saying here is that people are more than their thoughts, feelings, and experiences. Like, if someone has a thought and it's a negative thought, maybe it's a thought that, like, I've talked about patients who have new babies and they have like this weird thought they're going to hurt their baby or they're going to whatever. And they're horrified by it, and they can't understand that it's just a thought, and maybe it's highlighting their value, and the thought's just, the subconscious is a weird way of making us get our attention, right? And we don't need to get into all that. All this is really to say that this is an important part of ACT, is that you are going to have all kinds of thoughts, you're going to have all kinds of feelings, you're going to have all kinds of experiences. And none of that is you. You navigate that the way you see fit, and you the most important about this thing, because this is acceptance, right? So you're not gonna choose your experiences, you're not gonna choose your thoughts, you're not gonna choose your feelings, but what you're gonna have to accept those. But what you can choose is your values and your goals, and the act is accepting those thoughts and those feelings and those experiences and committing to following your goals and your values despite them, right? That's basically it.
Yep. So with ACT, they also suggest that we can't experience all of life if we try to cut out the negative part, right? So that, I think that's a really important message. So it kind of goes back to an earlier thing you said. So like a lot of this is just us reiterating kind of similar things to how we started this podcast. But if you try to cut out pain, if you try to cut out panic and discomfort, you're not having a full life experience.
Mm-hmm.
It's kind of like that thing we said a long time ago on here.
I know exactly what you're talking about.
You need to have a little bit of like suffering in order to really understand what joy feels like, right?
Yeah. Like if someone was about to put you down on earth and they said, you can live a life with no pain, panic, or discomfort, like you said, and that might sound good, but you'll also have no joy, no love, no happiness, no laughter. Like, would you choose that? Like, would you choose to feel nothing, or would you choose to feel everything? That's what this act is kind of all about. It's like, yeah, you're going to have some discomfort. You're going to have some pain. You're going to have some panic. Sure. But you're going to have that is saying that you're going to have everything too. If you want joy in your life, you want happiness, you have to accept that you're going to have the other side of that too, to have a full life, to experience the whole human experience. And that's how you learn. Like there's this great Woods Brothers song, Happiness Jones. And the whole premise is like, I've never learned a thing being happy. And that's true, right? Sometimes like those hard things that happen to you, those painful moments in your life, those breakups, those, when a period in your life where you're judged, those hardships or whatever, like years later, you're kind of like sometimes thankful for those moments because they created you who you are today. And without them, you would have been someone totally different.
Yeah.
And it's not always that way, but it's certainly sometimes that way. Like Holocaust survivors seem to have felt that way, right? Like they wouldn't have been as good of a person or had such a rich life had that not happened to them. And that's not saying that they are glad that happened. And if they could do it all over again, they would. But they are saying that, and it's a hard thing to say, that because that happened, I am a better person.
Did you know that Pharrell wrote that song Happy because he was coming out of a depressive state and he was feeling joy?
No, I didn't.
Oh, that's because that didn't happen, but that would have been a cool story to tell, wouldn't it have been?
And it was, okay. Because I'm thinking of like Minions. I see all the Minions running around. I'm like, they're happy.
They are happy, I guess.
Yeah, they are.
I've never seen Minions, but yeah.
Oh, it's good stuff, right? So, again, what we're talking about here is, well, the next part of this is something we mentioned too, is like identifying your values. We talked about how you do that. But ACT is all about committed action, goal setting, exposure, right? Skill development, which the skills are kind of, there's a lot of metaphors. There's a lot of metaphors. Did you come across any like interventions that you really liked with this, or?
With the skill development piece? No.
Yeah, I mean, there's one that I like that I used a few times where, like, you kind of use the wall behind you, and when people are having like, intrusive thoughts, or, they're feeling really depressed. You kind of use it for everything, and you could say like, "Hey, look, this wall's behind me, right? I don't like that it's here, and that's your depression, that's your intrusive thoughts, that's your anxiety, that's whatever." And you could say, I can like kind of push against it, and I can hate that it's here, and I can, as long as I have my hand on it and I'm trying to remove it, I'm engaged with it. But if I turn around and I let it be there, then I can still focus on whatever I want to focus on. I can still do the things I want to do and have that wall be there. I might not like that it's there, but I have to accept that it's there. I can't move it. But that doesn't mean that I'm stuck here with it. That doesn't mean I have to constantly try to fix it. That doesn't mean I have to work on it forever. But I can accept that it's there and move on and live my life.
Sure.
So basically, the idea is that it's counterproductive to try and control painful emotions or experiences. You can't do it. So the suppression of these feelings, trying to do that, causes more issues. So instead of trying to change the way you think, you can use your values, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that you're doing, you can use your values, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that matter to you, as a compass to commit to action. And by changing your behavior, the things that matter to you, as a compass to commit to action. the thoughts and experiences that were troubling you are changed by your new attitude, your new confidence, your new emotional state. Like, think about, I've been going to the gym a lot. If I'm like upset before, like I'm having a hard day, or I'm maybe I got into an argument with someone at home.
Sure.
I'm upset before I go to the gym, right?
This guy.
But it's a value of mine. I
This
go
guy.
there and I change.
And you're so cool, Greg. And you're so cool.
Thank you. Thank you.
I've been going to the gym a lot, and
I mean, I don't know if you guys have noticed. I know this is on YouTube now.
it's hard to notice when you're just a talking head. So
yeah, my head hasn't shrunk, as big a head as ever.
When we said something at the office about it, and it's like, you're all head now.
Yeah, yeah, true. I get it.
You hated that. That was cool.
I didn't love it.
It's a fun activity is to ask, like, if you work with adolescents, or if you have an adolescent, I guess you could ask them about their values, and also ask them, like, who are you? Like, strip away all your friends, strip away, these other outside influences. Who are you underneath all that? And I think it's fun to like get adolescents to start thinking about that, because a lot of times they don't, and they become everybody around them, right? And like, It's not to say that any of us are void of like doing that to some extent. Like, we all do it. We're all influenced, obviously, by external. That's impossible not to. But like, sometimes they over-identify as the people that they surround themselves with, and sometimes that changes if they bounce friend groups, or if they get into new interests, and suddenly they're only that thing. So it is a fun little thing to start to get them to challenge themselves and think about that.
I honestly think, Dave, like the longer, we kind of do this, and the more interventions and theories more than anything, we kind of really introduced, I really do think that it basically comes down to that thing that we've talked about multiple times, where becoming someone you admire is the best advice you can give somebody. Because what are we talking about here? It's like, all right, so we're identifying your values. That's essentially finding out what you admire and becoming that. And it supersedes everything. So it's like, you could feel all these things inside. All these things could have happened to you, but if despite that you try to become someone you admire, I mean, it just seems like that's what this is all about. That's what any of this is all about.
For sure.
And so values are the key to that. And we've been saying that for a really long time, and no one's really no one's riding along with us.
No one's giving us the credit we deserve.
Yeah.
You guys better watch out. Greg's been going to the gym.
It's a new value.
So another super important piece of this is something we touched on earlier, but I just want to go more into it. There is no moment or feeling that is permanent, for good or for bad. So intense feelings that we might feel, like when we fall in love, those feelings of euphoria, as we talked about in the love languages episode, or like the first time you might hold your baby, or little things like that, like those intense, strong, positive emotions. I got news for you. Eventually they're going to change. Your relationship to that experience will eventually change. It's not like you're going to like no longer be in love, but that feeling of love is not going to be as intense forever, right? So the same is going to obviously go for intense negative feelings. Like, over time, they will change. So you have to remind yourself of that, and that will hopefully help your relationship with whatever that intense experience. Hopefully you'll learn that it is eventually going to adjust and become less intense, and that will hopefully help with some of the suffering you have with that emotion. So
that is like so great. Like I kind of like it. I screenshot a poem today, and you just made me think of it. I swear on everything, I was not going to bring this up, but this is a Robert Frost poem, and it goes. It's so short. Ready? The way a crow shook down on me, the dust of snow from a hemlock tree, has given my heart a change of mood and saved some part of a day I had rued. So basically, this guy's walking in the forest. A crow, he's all upset. A crow shakes off a little bit of snow. It lands on him, and now he's in a good mood. So it's like, you're right. Like, moods are so fleeting.
Yeah.
And we we know that about good moods. We know that about like when we're in bliss, when we're in like the zone, or maybe we're like, I don't know what makes you happy. It's hard to remember, right? But
Right.
like you have these moments of like happiness, and they're so fleeting, but they're so important. But we forget that like when you have these moments of intense negativity, those intense moments, they don't last as long as you think. Sometimes it's just thinking about it that lasts a little bit longer, and like wondering when it's going to happen again, and like all these things, right?
You know,
But you're right.
You ever stub your toe?
Yeah.
You stub your toe, and for a brief moment in time,
You almost throw up.
you're like, oh, and then you know what I've learned to do over time before I ever learned about any of this stuff. I started to tell myself, it's only pain, it will go away. It's only pain, it will go away. And it has decreased that the amount of time that experience feels like for me, because I'm now channeling my thought into like, this is going to dissipate.
Yeah.
And eventually it does. And then I'm like reminded and reinforced that, oh yeah, that is true. So some good things that like this train of thought is helpful for. Well, this totally reminded me, first off, when we did the self-injurious behavior episode, and the whole riding the wave we talk approach to cutting or any kind of self-harm. It's an urge. That urge will eventually dissipate. You have to just anticipate that urge is going to get intense, and do your best to hold off on acting on it, because you don't have to. That urge can't force you to do anything. It's just a feeling. And then you will see and be reinforced by the fact that you did not act on it. Cravings is another thing, though, that this can be useful for. So if you have issues with like cravings for food or cravings for anything, they may be uncomfortable. It may be intense, but it's a transient event, meaning it's going to come in like a wave, just like I just talked about.
Yep.
It will have a crest and then it will recede. So if you envision that intense emotion almost like a wave, you can almost envision when it gets to that peak and then it suddenly starts to recede.
And you're teaching yourself something great there too. Like you're not letting your emotions change the path that you're on. You're like, this is going to happen, and it's going to make me feel a certain way, but I'm not going to let my emotions put me in a different direction if that's not where I want to go right now. Empowerment. Back
to that word of empowerment that we used earlier. And you know what's funny? Because like I know ACT goes a little bit against control, but it goes to that statement that you said earlier. You can't change everything around you, but you can have control over how you act, right?
That's right. That's the last freedom. That's Frankel's stuff. Like we only have control over our reactions and our attitude towards things. Yeah. And that's powerful, right? Whatever could happen to us.
This is exactly, I know this is a little bit off topic, but like when young kids come in and I hear that like they're being bullied and they're like, they're getting in trouble because they're fighting back against the bully. It's never I'm not suggesting that they allow someone to bully them, but I do often talk about this thing. It's like, you don't have control over that other person, but you do have control over how much energy you give them, how much attention you give them. You got to think about the response they're looking for. And if you give them that response, they're just going to do it more and more and more and more, right? It's the same thing for this negative, intense emotion. If you give it what it wants, you're reinforcing it. So then the next time you're going to continue to feel it. It's going to be more intense. And eventually, trying to stop the behavior could be really challenging at some point. It's not going to get easier the longer you prolong it or the more you reinforce it. So it is helpful to try to do it early on, but ultimately it will never last forever. It can't. So pain is another one, because hurt, it hurts, but it's another transient event, and eventually that hurt or pain will dissipate. Chronic pain's a tough one. So, because chronic pain does not necessarily go away. Well, it doesn't go away. It's chronic.
No,
but your relationship to the chronic pain can change.
What's interesting about the chronic pain aspect is, so Stephen Hayes doesn't have chronic pain. He's like in the late 70s or 80s. But what he does have is the tinnitus.
Tinnitus, yeah.
Yeah. So that is, having to accept that and not change that. Yeah, like think about that. That's like so something I listened to with him this morning, and he talks about it. He's like, I was able to kind of accept this thing, like this ringing in the ears. To some people, that can even like be like cause like suicidal thoughts. And he learned to accept it. And people were like, well, I have tinnitus, and I'm having a hard time accepting it. It's taking me a hell of a lot longer than a week. And he's like, well, it's taken me a lot longer than a week too, because I've been working on this for like 40 years. This is my this is my career, you know. But you know, it is about how do I wish this wasn't here. How do I change this? How, you know, it's just one of those things.
It changes your thoughts. I mean, it changes your experience with that feeling once you learn to anticipate it and expect it and understand that it's always going to be there, but I'm still going to move forward with my life and try to create a rich and meaningful life. And that's what it's about. It's not denying that it's going to be there, because that's fictitious. It's not avoiding. It's not, I'm in pain, so I'm just going to give up. It's, no, I have pain, but that's not going to stop me from still trying to find some moments of joy in my day. And I know that's a super challenging and almost, you know, it's one of those things that I would be really cautious of how I word that to someone who experiences chronic pain, because I understand that is like something that's never going away, and that person's going to experience that for the rest of their life. And
but what's the alternative?
Minimize there. Exactly. It's not to minimize, but it is to just point out that, yeah, you're right. What is the alternative?
Like, your life is going to suck. You're not going to have any joy ever again. This is always going to be terrible. Like, it's, you know, by sort of believing something, and having like optimism with something is goes a long way to making it true. Like, if you're thinking, I have this chronic pain, but I'm going to still have a kind of find joy in my life. I'm going to still find meaning in my life. Maybe I'll try to like alleviate the suffering in others. Maybe I'll try to find a way to kind of like, how do I talk to more doctors or go to more, you know, specialists to figure out maybe this can one day be relieved. But living your life like in a hopeful manner is better than saying it's just always going to be like this. I'm going to get worse and worse and worse. I'm going to die. Because that's like, that's not life.
So one way that like, so I live with someone with chronic pain, and it's super, you know, debilitating for her. And then it's the worst. And one thing that she does that I actually think as I say it out loud, I appreciate it probably more than I even acknowledge to her. But like, she often says like, I want to do things now while I still can, which I think is a great way to look at it. Even though, you know, it's still painful, but also some days are worse than others. So on those days that aren't so bad, take advantage of those days, and the days that are worse, then do what you need to do on those days. And that's, you know, I think that's a really interesting way to look at it as well. Like, I'm feeling better than normal today, so today I can take on this load. So, you know, there's different ways to have relationships with the pain that you experience, and you just have to I don't know, find ways to focus on that relationship with it.
All right, and like finally, let's talk a little bit about this last, you know, core principle, so when we were saying before that, you know, people have take issues with ACT, especially Dr. Burns, who we're huge fans of. And maybe part of the reason why he takes, you know, he doesn't have the best things to say about ACT is because it kind of threatens his life's work. But I think there's a place for both of them. I think both are very useful. Anyways, functional contextualism. So like that's a crazy sort of phrase that just basically means that all behaviors have a context. That's it, and a function. So like, your behaviors made sense once upon a time, and maybe that's evolutionary. Maybe that's, you know, developed when you're in childhood, right? Like the emotions that you have are, you know, they're there for a reason, and maybe they're useful and maybe they're not. So like, take what's useful and leave what's not. That's basically what it's saying. And also that there's no universal truth. And like we're kind of saying before, like, what you believe to be true goes a long way to being true. Like I think of this example as like a couple, if we were lost in the woods, Dave, if we were like, hey, if we walk this way, we're eventually going to get out of here. That might save us, right? And if our other belief was, if we believed it was true that like we're too deep in the woods, there's nowhere we can go to get help. Like if we believe that, then we're screwed. So like what you believe to be true really goes a long way to being true and helpful. So I don't know. There is a tinge of optimism here, which I don't think there's anything wrong with. I think that's a good thing.
Sure. You know, and one other thing, and I think we touched on it, but I don't think we really delved into it too much. But like the idea of the universal truth, there's no universal truth. But that's also very true within the language that we use, and it's important to like be mindful of that. And much like what we do with CBT and the cognitive distortions and how we reframe them, that's also sort of present in ACT, because one way that we do that sometimes is we use this like this global internal like language, such as like I am depressed being an example, versus I am feeling depressed today, or I have been experiencing depression. People say I am depressed. Think about that statement.
I know.
I am depressed.
I am depression.
It's like who I am. Yeah. And one of the things I heard about that is like, which I thought was a great point, is it makes it feel unchangeable because you are it. So how do you change that? Right. Versus I'm feeling depressed. And
that, and so I think Dr. Burns could take comfort in that. And I think what his critique of this would be is like, if he listened to this podcast at the end, he'd be like, oh, so they had this cognitive distortion, I am depressed. And we challenged that distortion and changed it to I am depressed. I am feeling depressed. And now we feel significantly better because we're changing that thought into something that's a little more palatable. And it's like, yeah, kind of. But also it's more than that too, right?
It's more than that.
It's almost like
it's a piece of it, but it's more than that.
Right. It's almost like when you tried all the cognitive distortions, when you tried restructuring all the thoughts, and you can't change it anymore. There's just still this thing there. It's like, well, what do you do when you can't do anything anymore? You have to accept. And that's the part that's sort of left out of CBT.
Yeah.
And maybe this is like a, next step, or
for some people, yeah,
an amendment.
When we both first started this podcast, I think one of the things we emphasized was like, we don't go too heavy into one theory versus the next, because we understand the idea that like there's no person that one theory. I mean, there's no one theory that works for every single person, right?
Yeah, absolutely.
Do you still believe that?
1,000%.
Okay. So that's why I think like this has importance, and
Absolutely.
This has a place. CBT has importance. It has a place. DBT has importance, has a place. I'm just throwing out letters for people who don't understand them. There's an episode about CBT. Please go listen to that if you haven't yet. Cognitive behavioral therapy. It's so important. Acceptance commitment therapy is so important. And I'm glad we were able to do this episode. And at some point, we'll definitely do dialectical behavioral therapy, because I think that's very important as well.
It is. And now, Dave, now having said that, because I do firmly believe that no therapist should be married to a single theoretical approach. But if you could heal the most people with one theoretical approach, which one do you think it would be?
I'm still probably going to say CBT for the most part.
Me too.
But I do think that ACT is really nice for those individuals who are, I'm not going to say treatment resistant, but just really struggling with some lingering things that probably are just part of their personality that aren't necessarily even going to go away.
When it's time to really get out of the head. And I don't know, because both CBT has components of like values focused, work.
Oh yeah, for sure.
Like behavioral activations, basically, doing the things that were used to be meaningful to you and that you don't enjoy anymore, even though you don't feel like doing that, and then hoping that the mood will follow the action. That's part of CBT. So I agree that CBT is still pretty much, because it's so broad and big, and it covers so much. It's simplified too. Like it's simple.
That's what I've always appreciated about it. I think very easy to understand.
Yeah, but this is not.
Yeah,
it's not. It's just not. And when David Burns, who was a student of Beck, who created CBT, when he had Stephen Hayes on his podcast, he was really kind of, I don't know, rough with him and critical, maybe because he was threatened, but maybe because he thought he was pretentious. I don't know.
No, I mean, well, maybe those were thoughts he had. I can't speak for him, but what he said in that episode was exactly how I think probably a lot of people were feeling. David Burns, if like you're not familiar with him by now, we've mentioned him a number of times. But he's really big in like the CBT treatment, and he has this whole team CBT work that he does. So he's really big into it. He wrote the books Feeling Good and Feeling Great, which we're both big fans of. But his whole thing is about making these things not for therapists, but for anybody. So you can pick up a book and you can work on yourself, and you can, work with a therapist, and it's supposed to be easy to understand. And his big thing to Stephen Hayes was like, if people are listening to this and they're not in this field, they're not going to understand this. Why would you create something that people don't understand? How does that benefit them?
Yeah, like why would you say functional contextualism?
Yeah. Right.
Exactly.
I think it's a great argument. I think, why are we making things solely for therapists to understand? And even us, like sometimes we might not get it.
Yeah.
It's rather than just for the common person, if it's for them in the first place.
Yeah. Like, if, any field, right? Like if it's the HVAC or the plumber or the electrician, they all have their like acronyms and their lingo that like no one really understands unless you're in that field. And we have
like
that too.
Postmen
do too. And so do just about anything you could think of, right?
Like, what would be postman lingo?
UBBM. Everyone would know what that was.
You have to go to the bathroom.
Yep, that's exactly right. That's just like junk mail. What else?
UBBM is junk mail.
Yeah, ANK, IA, insufficient address, attempted not known.
What do you call like your area that you have?
That's a route.
Oh, wow.
Petty stuff.
Your beat. You call it your beat. I'm gonna go walk my beat.
Yeah, now like yeah, but you see, right? Like that makes perfect sense. Like every single thing has like its own lingo, and how would you understand that if you're not in the field? So I think when it comes to mental health, we should kind of have like a universal language that we can kind of all, or just keep it simple. Like CBT tries to. Although cognitive distortion is a little weird too.
Yeah, but when you give people, I've given the cognitive distortion sheet to people.
They love it.
And like young patients, old patients, everybody looks at it and they're like, yeah, I do that. Yeah, I do that. So they get it. That is a big testament that is an easy thing to comprehend, because people look at that. I've seen it 1,000 times. They just look at it like, yeah, I get that. Yeah.
Like if you tell people like one of his themes is, we didn't even get into it, but it's called pragmatic truth criterion. Like, really? You're going to bring that up in session? Like, that's, I don't know. You know what I mean? Like that, and then what it means is like effectiveness of action is judged by how well it meets its goals. Like what? Just
there's an easy way to explain this.
Yeah.
But I guess that's what, he's creating the layout, and our work is to make it understandable.
Interpret it, I suppose. Yeah.
So here we are.
Yeah. All right. Well,
no, that is ACT.
That is it.
Unless you have more to share on ACT, Greg.
No, I think that's it. I think we kind of got our certainly got our message across, especially because it basically it's accepting what you can't change and committing to action based on your values. That's basically it.
Before we fully wrap up today,
okay,
we received a review.
Okay,
which my phone will, of course, it's not loading right now for some reason. All right, here it is. So it was from Shirt Merman. I hope that is his real name. Love this. As a graduate student in mental health counseling, this is a fun way to reinforce things that I'm learning and dive into topics we haven't touched on yet. Balanced on the palate with a blend of info, insight, and humor.
That's cool. Really nice.
Nice to hear. We've been saying this for a little bit, and Greg, you reiterated it earlier today off air. We definitely seem to hit a demographic with grad students and students in general in psychology, it seems like, which is really cool. For people who have been following us from day one, our episodes have kind of always been like I'm not going to say they've always been the same, but it's always been this same kind of different blend of like one week it's something serious, the next week it's like maybe something paranormal. It's like we've always done that.
Yeah.
But what people probably don't know is before we even released our first episode, we had recorded the Uncanny Valley episode with the intention of actually making something that was more like heady or directive for like students.
Yep.
Like academic people. And like, but we wanted to do it in a way that we thought was fun. So our goal initially was always to be geared toward more academic. But like, I have to say, the amount of people we reached that aren't in academics also is like awesome. So it's cool that we're like, we kind of hit that demographic, but then we also at times hear from people that have nothing to do with, you know, the academic world and have just like had their own experiences with things and they're taking appreciation in these topics or they're finding it interesting. So I think we're kind of doing what we set out to do in many ways and maybe even like exceeded that in some.
Yeah, no matter what happens, it's been
wow
great.
No matter what are you doing?
No. Hey, listen, I'm in for the long haul. I don't care.
Why are you talking all about all this right now?
I just mean like,
what? I just mean, what?
It came out the wrong way.
Yeah, I will say.
I just mean that no matter what, if we get and then wildly popular or if we stay moderately popular, I'm in it for the long haul, no matter what. Because the people because all it takes is like every time someone leaves a review, I'm completely reinvigorated.
No, that is 100% factual right there.
Yeah, one person sat there and listened to us for an hour. One person, obviously it's more than one person, thank God. But like that person took the time to be like, oh my God, that kind of sat with me enough that I gotta like figure out how to use my phone and go through this thing and write a review. And we appreciate the hell out of that.
And even like, I know this week somebody had reached out and they were talking to you a little bit about something that you had said. I just thought that was so cool because it's like, you know, not only did this person listen to our episode, but then they actually picked up on this other thing that you talked about. They wanted to like pick your brain about it or just like kind of share that like, oh, I'm have some relation to that thing too. I just think that's really cool.
Fun.
The connection piece is really cool. So thank you to Chert Merman for writing that review. I will, always ask at the end of every episode, as always, if you haven't done so yet, we greatly appreciate ratings and reviews. The review piece is more, it is super helpful on Apple Podcasts, but like also like Greg said, that is really also great for us to know because we just are always curious, like, are people connecting with this content? Is it still hitting its mark? Even if like 5 months ago, it seemed like it was, that doesn't mean necessarily, here we are today, it's doing the same thing. So if you haven't yet, we do encourage you to do so. We also have our subscriptions page, which you can look up. It's on Buzzsprout. That's super helpful as well, just to kind of help us, continue to build this brand. And then again, if you're not watching us on YouTube, give it a watch. Maybe you'll like what you see,
At least subscribe, you know what I mean? And that's our buddy Hunter Jones that was talking to us on Instagram from Georgia.
Yep. I was wondering if that was Chert Merman, but maybe it's two different people.
Maybe it is Chert Merman.
I don't know. But yeah, if you can subscribe and like on YouTube, that's also very helpful as well. Anything is helpful.
Yep.
If everybody does one thing,
the world will be a better place.
And then we're going to ask you to do two things after that. But if everybody can just do one thing for now.
I'm going to go back to something we used to do. You guys are going to love next week's episode.
Oh, boy.
It's a real humdinger.
I can't even believe what it is.
I know.
See you next week.
Buckle up.
All right, everybody. Have a great night. We'll talk to you next week. Oh, and we are so close to spooky season. So you better believe we have a packed agenda. Big shout out to our buddy Joe, who suggested some episodes. And I think he's going to be pretty happy that we are taking him up on at least one of those for next month to fit the spooky season.
Yep. A long-time friend of the podcast, Joe.
Yep. But anybody else, if you guys have recommendations, things you want to hear us talk about, things you want to learn about, let us know. But yes, we'll see you guys next week.
And one more thing
Everyone.
before Davey, before you do get off though,
Yeah.
if you are interested in this, all this Halloween talk is getting you amped up for like, oh yeah, let's get some spooky episodes in. We've got a couple years worth of spooky episodes. If you go back to the previous Octobers and
Even a Halloween special.
even a Halloween special, you know, let's get that.
That was a very underappreciated episode.
It was a
that was
great
a-
episode. I almost feel like we
fun.
should re-release that as a bonus.
Yeah.
Okay.
It didn't do great.
It didn't do great. It didn't do great.
They can always go. We don't need to really re-release.
It has
They can
Greg
go back.
Charpentier original stories on there. And
Oh yeah,
it's,
we read stories on that thing.
yeah,
Wow, we actually narrated stories.
we sure did.
Did we ever actually talk about the short film?
We never talked about the short film either.
The heck?
I don't know why we're talking.
Greg wrote a story, a short story, which with some help and some friends, we turned into a short film. It's like what is it, 6 minutes?
Yeah, it's pretty great.
6-minute film. It's on
Stars
our
Dave.
YouTube page. Yep, I'm not starring in it. I'm a little minor piece in it.
Yep.
But yeah, check it out. If you guys haven't, it's something.
It's something. I mean,
It is something.
you guys, it's only 6 minutes, so you can get through it.
Yeah, I mean, come on. You guys have done
Oh,
worse things.
And if you like our songs in the intro and outro, it's scored by the same 13th Ward Social Club.
yeah,
Fantastic work.
who does
So,
he does our podcast intro and outro, and he does that. And the song he did for that was a lot different than what we have on here. But I love that song actually that he did on the score. And he's got some merch on his social media, so I want to plug that as well. Go on his social media, buy a shirt, buy some music from him. He's great.
Yeah, he's great.
So, all right, everybody, we'll let you go. Have a great night. See you next week.
See you next week.
Peace out. Go big.